I'm often asked about dark circles under the eyes, and I really have to look at what is causing them. So I'll ask the patient, when do you notice it the most? And they'll tell me that, generally in the morning when they're in front of their bathroom lights, or at the airport when there's harsh overhead lighting. And that kind of overhead lighting casts a shadow when there's a fullness under your eyes. So if you have excess fat, for example, there's going to be a shadow cast under those fat pouches when you have overhead lighting. And that's a simple fix. To remove a little bit of fat, that's a great thing. Sometimes that particular scenario is complicated because there's a descent in the cheek, so we're seeing more of a groove there. And sometimes that can be treated by filling that groove in and removing some of the fat, or just filling the groove in. Sometimes there's no fat. And what we have is basically pigmentation, and we see that in patients who have severe allergies or whatnot. They actually have darker skin around their eyes. That can be lightened with laser, it can be lightened with bleaching cream, sometimes satisfactorily to the patient. You have to decide, are we looking at a lighting phenomenon? Are we looking at actual color difference of the skin? Another reason is that you can have a little bit of darkness but a little bit of excess skin. So when you have extra skin around your eyes and then you remove the skin or you pull it up, it decreases the concentration of pigment, and so that it looks lighter. It's kind of like when you have a red elastic band and you stretch the elastic band and it becomes pink. It's the same thing. If you lift the skin and you put it under tension, the darkness now becomes lighter. And so really fundamentally, when you look at dark circles, the reasons are multifactorial, and you really have to sort of analyze what is causing it in order to institute the proper treatment. Sometimes the fix is very simple. A little bit of bleaching cream, maybe a little light TCA peel, and you can really improve the darkness under someone's eyes. But unless you start with the right diagnosis, you're not going to get the result you want.